10 implants with 3 different implant sites, which is facially sticking out. So that's why I would like to show you guys how can I finish it, how can I approach for this case. It's very thin, very sharp, right? This is big subgingiva, and then also the lower, we're trying to make thin as possible from the facial and lingual side too. Hi, thanks for watching my channels. My name is Luke from LSK121 Oral Prosthetics. Actually, I'm the owner and lab technicians. So I daily fabricated the difficult case, full mouth case implants, and from the different 45 different states. This case from Hawaii, okay, Hawaii to Chicago, and I make the time, then I can narrow down the procedure, what we do from the start and the finalize it. My goal is, regardless doctor, place implant with different setting and different direction. For example, sticking too much out is very tough situations. Probably that's why they send cases here. But here's the bottom line. Patient wants lifelike, thin, good prosthetic than any others. Right now, it's a lot of people doing this zirconia only. We do a lot of zirconia too, but there's a lot of limitations with the zirconia, especially these cases. So that's why I'm trying to explain to you the better why I'm choosing the Syton 7-star, which is our brand name. So I made it a lot. I made so many Syton 7-star cases. Whenever I see the cases long span ponic, they place implant more facially like this. Okay, so I change it, and then they really want the thinnest possible underneath ponic, and my prosthetics, or actually patient prosthetic, thin as possible, just like natural case, right? So that's my goal. That's why they pay for the money. That's why I pay for these patients willing to pay. They see the value, and then I can explain to a little bit more further how I did it. So we're recording some of the, especially I focus on the metal frame wall. It's hard to see the frame design from chrome cobalt, from the wax try or print type or tool types. So we're trying to minimize it compared to wax try in setup, compared to any other setup. Because they send the photo, then I can see it a little bit better. So for example, they make it a little thick, under contour. So that those kind of thing I have to decrease and increase, especially more decrease size, and then makes looks like piece, not bulky. Sometimes they need a bulky, right? Meaning their blood will wrinkle here. So I'm trying to make it a little better, more the form underneath, inside, and make them better support, lip support actually. Alright, so see the patients, we made the composite outside, trying to cut it back 2mm for Syton 7-star cases. And here's what we did. Now we're trying to make the frame design. Actually, we scan that one, so we merge it together.
Yes.
And the patient wear the PMMA. And now we finalize it, the frame design, which is 7 stars, lip support here. Okay. So we have to cut it. Now finish the metal frame. It's really hard time to one of the implants. And they make this, create the Syton 7 star. And then the upper and lower. Finish it. And then we're going to finish the after design by computer, which is file, and then after fabricated monolithic top and bottom, and then remounting. This is the digital wall. Another Syton 7 star cases. This, like I said, the 3 implant side is, unfortunately, the implant side is really facially out. So either we can sleep, so we can block actually that area so there's no hole. We can do that. But some doctors is worried about the only 3 implants, one, two, yeah. So we can sleep, but this case we can do make a hole, and then after this, and then we make the another crown, which is temporary cement. I have to make the notch here, so I have to make temporary cement. I have to screw down temporary cement so they can take it out whenever they need it. Okay, same thing here. Here's notch, and here is the another crown. Same thing, notch, and then here is the final restorations. You can see that one. Right. So first, the diagnosis from the model, and this model is very important. So doctor have to give me the good bite record or digital. Actually, this case we made it digitally mounted together from the print model, because this case from the Hawaii. So then from that we fabricated the lower and the Syton 7 star, same thing, because they don't mind if I can do with the zirconia because it's much cheaper, which is $2,000 cheaper. Problem is if I make the zirconia here and then color, it did not match compared to upper. So because the frame design is a chrome cover compared to zirconia, so I give them discount, okay, lower. So we made the Syton 7 stars much easier for us, and then we give it to them the best prosthetic as much as possible. So not only set up the symmetry, okay, and then translucency, the buccal corridor, golden proportion we set up here. This is an ankylosed implant, and also we give them this so they can use it whenever they go to nighttime. Alright, you saw the kind of brief information with while I'm grinding about the teeth, the frame design, those kind of things. Those things are dental laboratories fabrications, which is not many people show you guys. Maybe that's why I got a lot of subscribers, which is thank you very much. And so my goal is here, so I'm trying to help whenever they had a hard time, and then sometimes they don't need another implant site. Sometimes they have a wondering what they're going to do. That's what we are here for. By the way, I'm the lab technician. I'm not a dentist, so I cannot give you clinical advice. But we can give to our client. We work with over 45 different states, so we can give them referral to you guys. So any question, feel free to write it down, and then I can give you the answer as much as possible because I'm busy. I'm sorry about that. But anyway, maybe next times I can bring down another Syton 7 star case though. Okay, thanks for watching. Thanks for following all my social media, Instagram, Facebook, LinkedIn. Thank you very much.